We're very happy to welcome one of our most popular experts here at Experts on Call. His impressive resume includes heading up the Faculty of Child Psychology at the University of Ottawa, prior to lecturing in psychiatry at Harvard for 7 years before moving to Vancouver. More recently, though, he's become one of the leaders in the field of biofeedback and neurotherapy, which is the medical science of adjusting brain waves. We often hear the term miracle worker when we're doing this program. We're very lucky to have him in Vancouver and answering your questions today. It's Dr. Paul Swingle, and this is It's All in Your Head. Hello, Dr. Swingle.
Good morning.
I see your new website is up and running, by the way. Right off the top, I will tell our listeners, swingleandassociates.com. You can read along and listen to the program and see all the categories of help that is available through Swingle and Associates. And before we get into today's topic, which is fibromyalgia and chronic fatigue syndrome, let's talk a little bit about the therapy itself. I think it's still one of those things that people aren't familiar with, and then when they're exposed to it, they wondered why they hadn't heard of it before, which is something that you're battling all the time compared to medication. So let's talk about neurotherapy. How long has it been around?
About 4 decades. It started off primarily as a research area. What we were doing is looking at how brain activity was related to certain kinds of conditions, specific talents, specific mood states like depression, for example. It wasn't a clinical procedure because we didn't have the computing power back then. In the last 25 years or so, it's been a very important therapeutic technique, clinical therapy. It was developed largely at Columbia University and University of California in Los Angeles, in which they were working with animals, discovered that animals could control their heart rate, blood pressure, could control brain activity, and so forth. And if that's the case, then the conditions associated with brain activity can be treated as well. And that's exactly how it evolved. It's now an FDA certified and compliant treatment in the sense that all of the equipment is United States FDA certified and compliant. Basically, what we do is we look at how the brain functions. We do an electroencephalograph, which is a test of brain activity, which most people are familiar with. If you have a head injury and go to the hospital, they're going to do an EEG on you. And what we're looking for are areas of inefficiency in the way the brain's processing information. That's why I can tell people why they've come to see me, as opposed to the other way around, because we're looking for areas of inefficiency in the brain processing. Once we've discovered those inefficiencies, the way it's corrected is referred to as neurotherapy. Several different ways for normalizing brain activity. The most prominent one is neurofeedback. We set it up so that when the brain's doing what we want it to do, you'll hear a tone or see something move on the screen, and you learn how to self-regulate. If you're a young kid, we have you playing with electric trains, make electric trains move through your brain, that sort of thing. Good news is once it's fixed, it's fixed.
And it's painless. I think when you hear electricity, people worry, well, this isn't electroshock therapy or anything. It's very, very minute pulses that you're using.
You don't feel anything. We don't stimulate under conditions of neurofeedback. It's purely a feedback situation. There are other circumstances in which we use various forms of stimulation to nudge the brain into more normative functioning. But even those you don't feel.
So there's no pain. In fact, when I was getting worked on for my sleep issues, which is very relaxing, you have brain drivers too, which is something else. You're using light and sound and tone. How do you determine, though, what is a normal brain function? I mean, are there people out there who have perfectly normal brains where nothing is wrong at all?
You know, it's interesting. When we started looking for individuals who were normal, whatever that's supposed to mean, to look at the brains, what they do is a lot of psychological tests, and people who can survive those tests are the people that are considered normal. It started off at about 65%. We're down to a little under 40 now. But we have ranges in which if a person doesn't complain of certain kinds of conditions, you get an idea of what the brain looks like under those conditions. And if they do complain about something like depression, for example, you have a look at what areas of the brain look like they're lighting up. The technology we have now is extraordinarily sophisticated. As an in-office procedure, we can do what's called a RETA, which is low magnetic resonance, and we can look right inside the brain to see what the generators of the irregular activity is, and we can treat internal structures with surface electrodes. This area has developed markedly over the last few years.
As far as intelligence quotient, can you actually tell by doing a brain scan? Can you tell about intelligence too?
There are several measures that correlate very highly with written IQ scores. In fact, that's one of the things that we look at with the elderly. When you get to be my age, you have to watch certain brain activities to make sure that they don't decline. There are age-related declines. And if you can keep those areas within normative range, then you can prevent dementias, you can delay Alzheimer's. It correlates very highly with good immune functioning. Can we read the IQ directly? No, but we can get an indicator of brain efficiency, and that efficiency measure, as I said, correlates highly with IQ scores.
Talking to Dr. Paul Swingle from Swingle and Associates. And by the way, the new website is up and running. You can even listen to our first couple of shows. It's all in your head. Swingleandassociates.com. The clinic is downtown. It is always very busy, but not too busy for you. And chances are you or someone you know has suffered from conditions that are listed on that website. Everything from depression, psychosis, and the two topics we're going to talk about today, fibromyalgia and chronic fatigue syndrome. In fact, I know somebody, when we were talking before the show, you've hit absolutely on the head in terms of the symptoms and some of the fallout from these two things. And in this particular case, he was struck in the back by a 2x4, and ever since then, these problems have been accelerating. So let's talk about fibromyalgia first. What exactly is it, and how does one get it?
Fibromyalgia is considered a connective tissue disorder. It's characterized by pain, general pain in the body, and that pain tends to move around. So sometimes it's in the shoulder, sometimes it's in the leg, and so forth. It is also associated with a condition that patients refer to as fibrofog, and that is you really feel cognitively fuzzy. Your intellectual efficiency is markedly affected by this. They tend to be very fatigued. They also have severe sleep disturbances. That's usually associated with the pain. When they're trying to sleep, the pain keeps waking them up so that they don't get any restorative deep wave sleep, and it becomes a vicious cycle. They medicate themselves. Medication affects their sleep and affects their cognitive processing and so forth. These folks tend to be those individuals that spiral into more and more and more medication, and they become less and less functional. The cause of fibromyalgia, there are three general causes. The first is trauma. I'm talking about physical trauma now, exactly what your acquaintance went through. He was hit on the head. Automobile accident is a very common preliminary factor. The second cause is viral infection after serious flus or even subclinical viral infection. And the third is emotional trauma. Usually you have a combination of a couple of these things contributing. The other thing that we find is that there are usually pre-existing conditions. You tend to have poor stress tolerance, and then some of these other things start to happen and you develop fibromyalgia.
So in other words, you could be prone to that particular problem. Now, is there a relationship between fibromyalgia and chronic fatigue syndrome?
They tend to be sister conditions. You have folks that have those enabling conditions, physical injury, psychological injury, viral infection, and will develop chronic fatigue. There are others who will develop fibromyalgia, and there's some that have both. The treatment of them is very similar. In terms of neurotherapy, there are usually two specific areas in the brain that are inefficient in fibromyalgia and chronic fatigue. One is the back of the brain, which is the brain's ability to quiet itself, basically. And in the frontal cortex, we usually find excessive slow frequency in the front part of the brain, which incidentally is why these people complain about fibrofog. The front part of the brain is not working efficiently.
Is the term chronic fatigue syndrome becoming more accepted? Because I know that there was a time there people were saying, oh, chronic fatigue, well, there's no such thing, or this is something that is made up, but it's become more widely accepted and I guess more easily diagnosed nowadays?
Well, it's interesting. The subtitle of our program here is It's All in Your Head. And the two conditions that are most associated with physicians and psychologists telling a client that it's all in your head is fibromyalgia and chronic fatigue syndrome. There are very poor markers for this other than the person's personal report. I can't sleep. I'm chronically fatigued. I have pain all over. However, if you do a brain assessment, you can see it. You can see that deficiency in the back of the brain, and you can see the front part of the brain lighting up with slow frequency.
We're going to talk more about fibromyalgia, chronic fatigue syndrome, and why medication is probably the worst approach and some of the dangers of medication in treating these two issues. Plus, we'll talk about any issue that you have that is related to the brain or in your head. What we often find with this program is that it takes a little bit of courage to get up to phone and ask a question, but once it happens, then everybody wants to ask a question, and by the time the show runs out, we're out of time. So if you have a question relating to yourself or to perhaps a friend, family, loved one regarding brain activity or anything in your head, you'll be amazed by the number of conditions that can be helped through neurotherapy. Dr. Swingle is here to answer your questions and help you, and experts on call. We have a couple of callers on the line to ask about our topic of the day, fibromyalgia and chronic fatigue syndrome. We're going to talk about why medication is so dangerous in these particular cases, and we're going to answer any questions you may have about brain activity or anything involved with in your head. And again, Swingle and Associates are downtown. Their telephone number is 608-0444, and the new website is up and running. Swingle, which is spelled Swingle, S-W-I-N-G-L-E, swingleandassociates.com. As we go to Eamon. Eamon, thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head.
Hi.
Hello.
Hi. World Cup Sunday's not good, but I'm giving up the World Cup final to give this question. My daughter, who's actually listening on in Scotland, I got her to listen in this morning. She's actually listening to the program at the moment. She's had fibromyalgia since around about the age of 12. She's at the age of 30 now, and she's gone through exactly the symptoms that you talked about, tried every kind of drug, and obviously these things make a little bit of a difference for a short period of time. But normally she goes back to her existing conditions and become worse or whatever over the years. She has 3 young children, unfortunately, and that affects her state of health also, because it takes a lot out of you having 3 kids in normal conditions.
Yes.
So I'm very concerned about her. So Dr. Swingle, I'm excited to hear about your project and how it's going, and I'd be interested to ask you what kind of procedures happen from now or whatever would be if I was deciding to get my daughter involved in this.
The treatment of choice in this condition is, in fact, neurofeedback neurotherapy, in which you correct the brain condition associated with this. Now, we work in conjunction with physicians who will work on diet and supplements and all the rest of it to make sure that the health factor, dietary factors and so forth are taken care of. What I would recommend is that you access the certification site. The certification site is bcia.org, and in there they will list practitioners all over the world who are certified and licensed to practice neurofeedback. If there's one in Glasgow or one of the other large cities in Scotland, you may be fortunate to have somebody there. If not, we have people fly in from all over the world for periods of intensive treatment. Doesn't mean you have to come to our clinic, but there are clinics around, I'm sure in London, for example, in which your sister could have a period of intensive treatment, go back home, and then come back again in 6 or 8 months.
Okay.
So it was bcia.org?
bcia.org, and you're looking for an EEG specialist.
Okay, I was going to ask you a question as well. What is your success rate on people with typical fibromyalgia? Or is that not available or whatever?
The limiting factor in the success with fibromyalgia is how long the patient has been on medication. What happens is they are often treated for depression with antidepressants and some sort of sedative, and they become addicted to the antidepressants and the sedatives, and often they're using alcohol in addition to that. So we're dealing with a heavy-duty addiction problem in addition to the fibromyalgia.
She doesn't have any of those problems. In fact, the drug situation, as soon as her problem seems to get worse, she stops it. She has no addictions whatsoever.
Perfect. Our hit rate with that kind of person is extremely good. As I said, the main issue that we have is getting people off the medication so that we can start to modify brain activity. And once that starts to take place, our hit rate is excellent with these conditions.
Eamon, we talked off the top about the 3 triggers sometimes for fibromyalgia.
The trauma side of things may be involved heavily in this situation. Her mother and I split up around about the time she got this syndrome,
yes,
and it seems to have not been shaken off. And at the end of the day, she's probably listening in just now. She may agree or disagree on that factor.
Emotional trauma is very common in fibromyalgia, and we may have to deal with the trauma as well. We can see that in the brain map. When we do brain maps, we can see the trauma on the brainwave activity. And it's the most efficient psychotherapy on the planet because we release the trauma neurologically and then help the person process it. It's not one of these long, drawn-out years of going through the pain of trauma.
What I'd like to do, Dr. Swingle, is obviously I live in Vancouver. I'd like to maybe come into your office and we can discuss this more.
Absolutely.
When you've got more time. I'd be
Sure.
delighted to do that. In fact, I'll call back. I've got your number and we'll arrange that. And so I'm not taking over your show at the end of the day. But,
And you can get back to the World Cup.
That's exactly what I was going to say. And my daughter is smiling just now because she knows how important soccer is to me. But she's listening in Scotland. Her name is Emma. And I'd just like to say hi to her since we're on the phone. But, okay.
Hey, thanks a lot, Eamon. And hello, Emma, listening in from Scotland. There you go, worldwide audience listening in. And the great thing, as we talked off the top, is that once it is fixed, it is fixed. And that's really great news. Audrey, thank you for waiting so long. You're on with Dr. Paul Swingle. It's all in your head on CFUN 1410 AM.
Hi.
Hi.
I just tuned in a minute before I phoned, so I've missed some. But I was in a car accident in '92 and had a severe whiplash injury and soft tissue injury to the joint at the base of my skull and cervical spine. And it affected my vision straight away with blurred vision, and as though olive oil was smeared all over my eyeballs from time to time. It affected brain function straight away, where things that had been easy for me were all of a sudden really complicated. And then there was the pain issue that has been severe and never stopped. And I've had years of physiotherapy and craniosacral therapy and massage therapy and electrode therapy and wearing a TENS machine and massage therapy. I had injection therapy with lidocaine, acupuncture, intramuscular stimulation, Botox injection, basalt joint nerve block, magnet therapy. Heat therapy works the best for me as long as it's wet. And every kind of medication for pain and nerve pain, regular bony muscle pain and muscle relaxants. And finally, about 4 years ago, 75% of the time, pain was so bad that I thought I'd rather be dead than to carry on days and days like this. And I went eventually on to opiate medication. It's helped the most as long as I don't do stuff that aggravates it, which is a lot of different things. I've also had a trial of THC by prescription, I forget the name of it, and this Lyrica for nerve problems. I'm now trying Mirapex, used for Parkinson's disease, but apparently it's supposed to work well for people with fibromyalgia, and it's very sedating for me.
Yes.
And I've apparently had damage to trauma to the lower brain stem and something upper. So I'm very interested in what you say, but as I say, I just flipped on the radio just before I called, so I've missed a lot.
One of the things we talked about is how difficult it is once you're medicated, and I always feel so sorry for people that they don't find out about neurotherapy until they've tried everything else, and you've exhausted a lot of, money and time and I guess emotional. But Dr. Swingle will tell you all about how he can help you, and again, he's helped a lot of people in this very regard.
Yes, whiplash can be really critical in this kind of thing because very often you damage two areas, among others. One is the atlas, where the spine connects to the skull. That's one of the centers associated with all kinds of things, motor and vision and so forth, all the things that Audrey has been explaining. The other is no matter how you're hit, it always implicates the frontal lobes, and that's where we find the areas associated with cognitive processing problems and the deficiencies in the frontal lobes associated with the fibromyalgia. What we would do here is to correct those two areas with neurotherapy and try to get Audrey off of all of the medications that are, as she's already indicated, the cost associated with that in terms of fatigue and being out of it and sedated and so forth is quite high. She has a long history of having gone through lots of different treatments. Depression is undoubtedly an element here. So, there are a lot of bridges we have to cross here in terms of getting all of this sorted out. But these are the kinds of clients that we see. We're often referred to as end-of-the-road treaters. After you've tried absolutely everything else on the planet, then you discover us.
Which is too bad. When you talk about the cost factor and then what you just talked about earlier about getting people off the medication, you kind of wish that people could be conditioned to trying this first. So this is where it all starts. It's all in your head, hence the name. Dr. Swingle and Associates Associates and the clinic on Melville Street at 604-608-0444, Audrey. The website, swingleandassociates.com, and find out more about all the different treatments and just about the clinic in general. You feel good as soon as you walk in there. You have hope again that you can be helped, whereas a lot of people don't have hope and they go through all these things. We'll talk about the price, too, because it's the best deal on the planet if you look at all the costs of medication and other therapies that you've gone through. Going to get to Diane in White Rock in just a moment. We're going to continue with Experts on Call and Dr. Paul Swingle. His impressive resume, including heading up the Faculty of Child Psychology at the University of Ottawa prior to lecturing in psychiatry at Harvard for 7 years before moving here to Vancouver. More recently, he's become one of the leaders in the field of biofeedback and neurotherapy, the medical science of adjusting brain waves. Very lucky to have him in Vancouver and answering your questions today, Dr. Paul Swingle, and this is It's All in Your Head. You've already had a couple of callers. I'm sure feel a lot better just after talking to you right now, knowing that there is hope for fibromyalgia and chronic fatigue syndrome. Let's talk to Diane, who's been waiting patiently in White Rock. Thanks for waiting, Diane. You're on with Dr. Paul Swingle, and this is It's All in Your Head.
Oh, thank you. Thanks for taking my call. I guess my concerns are more related to mental illness. My husband and I have family history of mental illness on both sides. His mother is manic depressive and has been his whole life, and he has this older sister that has starting to have episodes of depression and psychosis. I have a brother who's a year older than myself who is diagnosed as manic depressive schizoaffective, and I have a twin sister who actually has bouts with depression as well. I guess my concern is we have 2 children ourselves, and my youngest, who's 9, is showing some emotional disturbances, and I'm just wondering if there's any way of determining if there's anything that we can maybe be proactive in terms of looking at our own children, since there's such a strong family trait in both sides of the family.
Yes, there are genetic conditions associated with manic depression, and so forth. The interesting thing about neurotherapy is it doesn't matter what the origin of the anomaly is, whether it's experiential trauma, whether it's genetic, or whether it's a function of some head injury. It's all correctable to a great extent with neurotherapy, regardless of what the origin is. There are some subtle differences in terms of how easy it is to do, but nonetheless, they're correctable. Manic depression usually has a very specific signature. One is a deficiency of slow frequency in the back of the brain, so that the individual finds it difficult to find peace in their own head. They can't find a switch to turn the brain off, other than sedating, which is one of the reasons they use sedating medication for that. The other is a inequality of, or an imbalance in the frontal cortex. And you have one area of the brain that is hypoactive relative to the other, so that it's rather like one side's trying to talk to the other, the phone's ringing and nobody's there to answer it. Once we get those areas normalized, a lot of these behaviors of both the manic and the depressive phase tend to modulate. Again, our purpose is to get the individual off of medication, or at least in terms of some of the manic medications, get it down into a more manageable range. Our hit rate with this is really quite good. It wasn't too long ago that this was considered virtually an untreatable condition, short of very heavy medications and so forth. But the evidence is compelling now in terms of what we're able to do for these things. But again, the bottom line is to do a brain assessment to see specifically what we're dealing with here.
Diane, what gives you the impression that your daughter may be prone to some depression or psychological issues?
I mean, it's very mild at this point, but, you know, because I think it's the big worry because it's so dominant in both sides of the family. It kind of sits at the back of our head. But the behavior is, it's more lack of emotional control in certain circumstances. You know, nothing real alarming. It's my son, actually, and he's quite young still. He's only 9. I may be overreacting. I don't know. But I do want to make sure that I'm proactive on his behalf.
Well, I'm a great believer in mothers overreacting. That comes with the territory.